We turn now to the Ford government's controversial plan to force the closure of several safe consumption sites in Toronto this spring. As Alan Carter explains, public health officials are warning it will have an impact on first responders.
Toronto's acting medical officer of health says that upcoming regulations from the province that will force the closure of half of Toronto's supervised injection sites by April will mean an increased risk of overdose deaths.
In the legislation, the sites that are set to close are those that are within 200 meters of a daycare, childcare center, school, or private school.
Toronto's top doctor explaining to city councillors at the Board of Health meeting what the closure of 5 supervised consumption sites will mean for the city. A supervised consumption site is defined as a healthcare facility that allows people to bring their own drugs to use in the presence of healthcare professionals. It was near a supervised consumption site in 2023 that a young mother in Leslieville was killed in the crossfire from a shootout. Shortly after, the province stepped in with new legislation. The province's change is designed to assuage community fears and concerns about these. And there's a lot of people who support it. What do you say to that?
Well, I think there's a lot of misinformation as to what happens at this supervised consumption sites. You must also remember that the sites are there strategically because the need was there first.
In her report to the board, Dr. Nakishi Lamptey says fewer sites will mean more calls for police and paramedics to deal with overdoses.
I think we can anticipate that if there is substance use that was previously done indoors and under supervision in supervised consumption sites, we can anticipate that some of those overdoses will occur elsewhere because those sites are closed.
The Board of Health has approved the city joining a lawsuit by a community group trying to stop those provincial changes. It has to be approved by the court first. The reality is that 5 of Toronto's supervised consumption sites will likely close by April, and that will put additional stress on the 4 that remain, plus police and paramedics. Alan Carter, City News.